Dear students, now we will come to the lecture of cholinergic agonist. You will see the autonomic nervous system somatic in front picture with all branches of the autonomic nervous system. We discussed it very well in the previous lecture. So let us start with the neurotransmitter at cholinergic neurons. Neurotransmitter in cholinergic neurons involve six sequential steps. These steps are in front of you. Let us discuss the first step. The first step is the synthesis of the acetylcholine, the major neurotransmitter of the parasympathetic or cholinergic nervous system. Choline is the transported from the extracellular fluid into the cytoplasmic of the cholinergic neurons by an energy dependent carrier system that co-transports sodium. The uptake of choline is the rate limiting step in the acetylcholine synthesis. Acetyltransferase catalyzes, let us say it again, choline acetyltransferase catalyze the reaction of choline with acetyl coenzyme A to form acetylcholine and ester in the cytosol. Number 2, storage of acetylcholine that produced in the first step. In vesicles, acetylcholine is packaged and stored into presynaptic vesicles by an active transport process coupled to the efflux of protons. The mature vesicle contain not only acetylcholine but also adenosine triphosphate and proteoglycan. Co-transmission from autonomic nervous is the rule rather than the exception. This means that most synapse vesicles contain the primary neurotransmitter acetylcholine as well as a co-transmitter that increases or decreases the effect of primary neurotransmitters, which means it is ready for the transmission for the most effects, as we mentioned, for the main effect of the acetylcholine in the previous lecture. Release of acetylcholine, it comes when a voltage sensitive sodium channels arrives at the nerve ending. Voltage sensitive calcium channels on the presynaptic membrane opens, causing an increase in the concentration of intracellular calcium. Elevated calcium level promote or stimulate the fusion of synapse vesicles that contain acetylcholine with the cell membrane and the release of their content into the synapse space. This release can be blocked by botulinum toxin botulinum toxin, which is used in many types of cosmetology. Binding to the receptor Let us say that it is binding to the receptor. Acetylcholine releases from the synapse vesicles diffuse across the synaptic space and bind to the postsynaptic receptor on the target cell. 2. Presynaptic receptor on the membrane of the neuron that releases the acetylcholine, or to other target presynaptic receptors. The postsynaptic cholinergic receptor on the surface of the effector organ are divided in two classes, muscarinic and nicotinic, as in figure 1. Binding to a receptor leads to a biologic response within the cell, such as the initiation of nerve impulses in a postganglionic fiber or activation of specific enzymes in effector cell as mediated by second messenger molecule, which is very well discussed in the previous lecture. Degradation is in the comes the post-junctional effect site is rapidly terminated. The effect of acetylcholine because of the acetylcholinesterase enzyme cleaves acetylcholine to choline and acetate in the synaptic cleft. You will show it very well in this presentation of the picture. Recycling of choline. Choline may be recaptured by sodium coupled high affinity uptake system that transport the molecule back into the neuron. This is the acetylate, and this is according to this process it will be acetylated into acetylcholine that is stored until released by a subsequent action potential. Choline receptors or cholineceptors. Two family of choline receptors designed muscarinic and nicotinic receptor can be distinguished each other on the basis of their different affinity for agent that mimic the action of acetylcholine, cholinomimetic agents. Muscarinic receptors. Muscarinic receptor belongs to the class of G protein coupled receptors, metabotropic receptors. These receptors, in addition to binding to acetylcholine, also recognize muscarinic and alkaloid that present in certain poisonous mushrooms. In contrast, the muscarinic receptors show only a weak affinity for nicotinic, as in figure 3a. There are 5 subclasses of muscarinic receptor. However, the most one on regards for the muscarinic receptor is the M1, M2, M3 receptors have been functionally characterized. Location of muscarinic receptors. These receptors are found on the autonomic effector organs such as heart, smooth muscle, brain, and exocrine gland. Although all the 5 subtypes are found on neurons, so all the 5 are in neurons and the others are distributed in many organs. M1 receptor are also found on gastric parietal cell, M2 receptor on cardiac cell, and smooth muscle M3 receptor on the bladder, exocrine gland, and the smooth muscle. Mechanism of acetylcholine signal transduction. A number of different muscular mechanisms transmission the signal generated by acetylcholine occupation of the receptor. For example, when M1 and or M2 receptor are activated, the receptor undergo a conformational changes and interact with G protein designated as G alpha, that is in turn activate phospholipase C. This ultimately leads to the production of a second messenger, inositol 1,4,5 triphosphate, inositol phosphate 3, and diacetyl glycerol. Inositol phosphate 3 causes an increase in the intracellular calcium. Calcium can then interact to stimulate or inhibit enzymes or to cause hyperpolarization, secretion, or contraction. Diacylglycerol activate protein kinase C, an enzyme that phosphorylates numerous proteins within the cell. In contrast, activation of M2 subtype on the cardiac muscle stimulates a G protein designated GI that inhibit adenylyl cyclase and increase potassium conductance. The heart responds with decrease in rate and force of contraction. So it has an inhibitory effect on the heart. Let's come to some of the muscarinic agonists. We will come to discuss it in details now. After nicotine receptors, these receptors adding to inhibit to binding acetylcholine also recognize nicotine but show only a weak affinity to muscarinic, as in 3b presentation or picture. This nicotinic receptor is composed of 5 subunits, and its function as a ligand gated ion channel binding of two acetylcholine molecules elicits a conformational changes that allow the entry of sodium ion, resulting in the depolarization of the effector cell. Nicotine at low concentration stimulates the receptor, whereas nicotine at high concentration blocks the receptor. Nicotine receptors are located in the CNS, the adrenal medulla, autonomic ganglia, and the neuromuscular junction in skeletal muscle. Those at the neuromuscular junction are sometimes designated neuromuscular, and the other neuron. The nicotinic receptor of autonomic ganglia differ from those at the neuromuscular junction. Now we will come to the directly acting cholinergic agonist. There is a different type of cholinergic agonist. We will come to discuss it, starting with acetylcholine. Acetylcholine, as it is a quaternary ammonium compound that cannot penetrate membranes, although it is a neurotransmitter of parasympathetic and somatic nerves as well as autonomic ganglia. It lacks therapeutic importance because of its Number one, multiplicity of action leading to diffuse or different effects, and its rapid uh, inactivation by cholinesterase enzyme. Acetylcholine also have both muscarinic and nicotinic activity. Its actions include the following. Number one, decrease heart rate and cardiac output. This action of acetylcholine on the heart mimic the effect of vagal stimulation. For example, if injection of intravenous acetylcholine produces brief decrease in cardiac rate, negative chronotropic or chronotropy, and stroke volume as a result of a reduction in the rate of firing at the sinoatrial node. So it will inhibit the vagal activity that regulate the heart. Decrease blood pressure. Also, acetylcholine causes vasodilatation and lowering of blood pressure by indirect mechanism of action. Acetylcholine activate M3 receptor found in the endothelial cell lining the smooth muscle of a blood vessel, this resulting in the production of nitric oxide from arginine. Nitric oxide then diffuses into the vascular smooth muscle to stimulate the protein kinase G production, leading to the hyperpolarization and smooth muscle relaxation via phosphodiesterase 3 inhibition. In the absence of the administered cholinesterase agent, vascular cholinergic receptors have no known function. Because acetylcholine is never released into the blood and significant quantities, atropine blocks this muscarinic receptor and prevents acetylcholine from producing vasodilatation. Other actions in the gastrointestinal tract: acetylcholine increase salivary secretion, stimulation intestinal secretion and motility, enhances bronchial secretion, also increases the tone of the detrusor muscle, causing urination, and in the eye involved in the stimulation of ciliary muscle contraction for near vision, and in the constriction of papillae sphincter muscle, causing meiosis. Let's come to the acetylcholine-like affected drug or medicines. The beta-nicole is an unsubstituted carbamoyl ester structurally related to acetylcholine. It's not hydrolyzed by acetylcholinesterase enzyme due to the esterification of carbamic acid, although it is inactivated through the hydrolysis by other esters. It lacks nicotinic activity due to the addition of the methyl group, but does have strong muscarinic activity. Its major action are on the smooth muscle of the bladder and GIT tract. It has about 1 hour duration of action. Beta-nicole directly stimulates muscarinic receptor, causing increased intestinal motility and tone. It also stimulate the detrusor muscle of the bladder, whereas the trigon and sphincter muscle are relaxed. The effect produce urination. The application or the clinical application in urology treatment, beta-nickel is used to stimulate the atonic bladder, as we mentioned, particularly in postpartum or post-operative non-obstructive urinary retention. The most adverse effect looks like acetylcholine. It is generalized cholinergic stimuli. This includes sweating, salivation, flushing, decreased blood pressure, and abdominal pain. Diarrhea may be also happen. Atropine is the antidote for this drug. Carbachol has both, not only muscarinic like beta-nicole, but has both muscarinic and nicotinic effect. Like beta-nicole, carbachol is an ester of carbamic acid and a poor substrate to acetylcholinesterase enzyme. This is biotransformed by other esterases, but at much slower rate. The actions carbachol has found effect both in cardiovascular, GI, and GIT systems because of its ganglionic stimulating activity. It may first stimulate and then depress the system. It can cause release epinephrine from adrenal medulla by its nicotinic activity. As we mentioned, that nicotine is found in the preganglionic sites. Locally installed into the eye, it mimics the effect of acetylcholine, causing meiosis and a spasm accommodation in which the ciliary muscle of the eye remains in a constant rate of contraction. Therapeutic use is because of its high potency, receptor non-selectivity, and relative long duration of action. Carbachol is rarely used therapeutically except in the eye as a miotic agent to treat glaucoma. So it's used only for the glaucoma by causing papillary contraction and decrease the intraocular pressure. Adverse effect. At doses used in ophthalmology, little or no side effect appear. Let us go to the pilocarpine. This alkaloid pilocarpine is an tertiary amine, stable in hydrolysis against acetylcholinesterase enzyme compound compared with acetylcholine and its derivative. It is far less potent, but it uncharged and can penetrate to the CNS at therapeutic doses. Pilocarpine exhibit muscarinic activity and use primarily in ophthalmology. Let's see that most of the acetylcholine-like effect medicines is used in ophthalmology. Okay, pilocarpine produce meiosis and contraction of the ciliary muscle when the eye undergo this meiosis. It experiences a spasm and accommodation. The vision becomes fixed and some particular distance at some particular distances, making it impossible to focus. Um, Pilocarpine is one of the most potent stimulators of secretion such as sweats, tears, and saliva, and it is used for production of these effects has been limited due to its lack of selectivity. The drug uh, is beneficial in promoting salivation in patients with xerostomia resulting from radiation of head and neck. Therapeutic use in glaucoma. Pilocarpine is used to treat glaucoma and used as drug in both open and closed angle glaucoma. Uh, Let us go to the adverse effect. Pilocarpine has caused blurred vision, night blindness, and brow ache. Poisoning with this agent is characterized by exaggeration of various parasympathetic effects, including profuse sweating, diaphoresis, and salivation. Now let's come to the indirectly acting anticholinesterase enzymes. Uh, these are cause the inhibition of acetylcholinesterase enzyme. Uh, the first one is hydrophonium. Hydrophonium is the prototype of short-acting acetylcholinesterase inhibitor. Hydrophonium binds reversibly to the active center of acetylcholinesterase, prevent hydrolysis of acetylcholine. It is rapidly absorbed and has short duration of action. Hydrophonium is quaternary ammonium and its action is limited to the periphery. It is used in the diagnosis of myasthenia gravis. So now hydrophonium, what is used to the in the diagnosis of myasthenia gravis, an autoimmune disease caused by antibodies to the nicotinic receptor at the neuromuscular junction. This causes their degradation, making fewer receptors available for interaction with the acetylcholine. So it is used for the detection of myasthenia gravis, which is autoimmune disease that causes degradation of the nicotinic receptor at the neuromuscular junction. So hydrophonium used for this diagnosis. Visostigmine is a nitrogenous carbonic acid ester found naturally in a plant and is a tertiary amine. It is a substrate for acetylcholinesterase and forms selective stable carbamylated intermediate with the enzyme, which then become also irreversible. Okay, irreversible inactivation. This results in a potentiation of cholinergic activity through the body. Has a wide range effect as a result of its action and stimulates not only muscarinic but also nicotinic sites of the autonomic nervous system, but also the nicotinic receptor of the neuromuscular junction. Its duration from 30 to minutes to 2 hours, and it's considered an intermediate acting agent. Also can affect the enter the CNS and affect the as an cholinergic effect. Used uh, serves as a therapeutic action in atony of either organs. The drug increases intestinal and bladder motility, so which is serves as its therapeutic action in atony, as we said, of either organ. Also used in the treatment of overdose of drug with anticholinergic action like atropine. Adverse effects. It may cause bradycardia and fallen cardiac output, and also which may also occur. Now let's come to the neostigmine. Neostigmine is a synthetic, not natural compound that is also a carbamic acid ester. It is reversibly inhibit acetylcholine, similar to that visostigmine. Neostigmine similar to visostigmine, but now let's come to this point. Unlike visostigmine, neostigmine has quaternary nitrogen, therefore it is more polar. It is absorbed poorly in the GIT tract and does not enter the CNS, not like so. Neostigmine, not like visostigmine. Visostigmine has CNS effect. Neostigmine has no CNS effect. Okay, and it can also stimulate contractility before it paralyzes. So the long duration of action can cause stimulation, it means contraction, until reach to the paralysis of the muscles. Therapeutic effect used to stimulate bladder GIT, and also an antidote for competitive neuromuscular blocking agent. Neostigmine also used to manage symptoms of myasthenia gravis. Yes, used anti-myasthenia gravis. The side effects include salivation, flushing, decrease in blood pressure, nausea, abdominal pain, diarrhea, bronchospasm, but it does not have CNS side effects, and not used in overdose toxicity to control acting antimuscarinic agents such as atropine. Neostigmine is contraindicated when intestinal or urinary bladder obstruction present. Now let's come to the pyridostigmine and ambinonium. Other cholinesterase inhibitors that are used in chronic management of myasthenia gravis, their duration of action is 3 to 6 hours and 4 to 8 hours respectively, but longer than the neostigmine, as we mentioned. Adverse effect of this agent is similar to this of neostigmine. Indirect acting or irreversible anticholinesterase agent Let's start with ecothiopate. Ecothiopate mechanism of action: an organophosphate that covalently bind via its phosphate group at the active site of N-acetylcholinesterase enzyme. Look please at the figure 8. Once this occurs, the enzyme is permanently inactivated as and restoration of acetylcholinesterase activity requires the synthesis of a new enzyme molecule. It means the old acetylcholinesterase stop its activity because of the permanent deactivation of cholinesterase enzyme. The phosphorylation enzyme slowly releases one of its ethyl group, the loose of alkyl group, which is called aging. So it acetylcholinesterase enzyme undergoes aging because of this coupling with the ecothiopate. Makes it impossible for the chemical inactivation such as the use of pralidoxime to break the bond between the remaining drug of the enzyme. The action, it is generalized cholinergic stimulation, paralysis of motor function, and convulsion, cause all acetylcholine effects in the body. Therapeutic use is a topical ophthalmic solution of this drug available for treatment of open-angle glaucoma. However, ecothiopate rarely used due to its side effect profile, which include the risk of causing cataracts. Thank you very much.